So good morning, everyone. This is the Tufts Research and Data Symposium for Food and Nutrition 2022. Thank you all so much for joining the Dietetics and Nutrition Communication career panel. My name is Mengxi. I'm a PhD candidate enrolled in the Nutrition Epidemiology and Data Science program. I'm so excited to be here and moderating this panel. So today we have invited 4 esteemed panelists to discuss their career opportunities related to the nutrition intervention, communication and behavior change, as well as the dietetic practice. Our panel is made of Commander Joseph Frost, the U.S. Public Health Service dietitian, Major Julianna Jayne, the PI and the military deputy chef of the nutrition division at the U.S. Army Research Institute of Environmental Medicine. We have Ayten Salahi, the GI specialized and the Monash trained dietitian, and Agnes Kwon, a registered dietitian, works with pediatric patients in New York City. So welcome everyone. I really look forward to listening or learning more about your career journeys through today's session. Before we start, we have a few quick logistics. We would like to inform everyone in the audience that the session is being recorded for potential publishing on our website. So if you don't wish to be recorded, please feel free to modify your name or shut off your video. Please also keep your microphone muted throughout the session unless you are called on to ask questions during the Q&A session. So you can enter your questions or comments in the chat box anytime. I think we are going to pin our panelists in the speaker view. So I suggest you go to the right corner of your screen and select the view so you will see them throughout the session. I'm going to stop my sharing my screen here. So you will see the speaker view laterly. So for today's panel discussion, I would like to invite each of our speakers to spend 2 to 3 minutes to give a lightning talk on their background, their current organizations, and the current work they are doing. And feel free to relate to any additional career paths or opportunities since leaving school. Then we will dive into some questions for about next 25 to 30 minutes. At that point, I would like to open the discussion up to the audience and to answer your questions. So as we go along, please put your questions in the chat. With that, I would like to ask Commander Joseph Frost to introduce yourself. If could, let's go with the order I just introduced you.
Okay, great. Well, thank you. Am I coming through okay?
Yes. Mm-hmm.
Okay, great. Well, thank you. And I want to thank the organizers for this opportunity to speak with all of you today. I guess for me, I'll start at the beginning. I became interested in dietetics as a high school athlete, really with just the belief that nutrition impacted my performance. And fast forward to my undergrad years at Rutgers University, I remember the professor saying that there's an internship out there for everyone. You just have to find the one that's a good fit for you. And for me, that wound up to be with the U.S. Army dietetic internship. And that has led me to a career consisting of clinical, community health, and some general military leadership positions as well, in Texas, Washington State, and even Germany. I had the opportunity to transfer to the U.S. Public Health Service. And I know not everyone is aware of the Public Health Service. And while the Commission Corps of the U.S. Public Health Service was established way back in 1889, we are still the least known of the uniformed services, and we're the only one dedicated to solely protecting America's public health. So while many are not familiar with the service, we are familiar with the U.S. Surgeon General, who provides operation command of the Commission Corps. And we're comprised of about 6,000 public health professionals, and that specifically includes approximately 100 dietitians who are dedicated to addressing public health as well as providing clinical care. And we fall under the Department of Health and Human Service. And again, our mission is to protect, promote, and advance the health and safety of the nation. I want to say that most of our officers work for agencies within the Health and Human Services. So for example, CDC, NIH, HRSA, CMS. And in my case, I've worked in the Indian Health Service and currently with the Food and Drug Administration. We actually do have officers in 800 different locations across the US and even a couple international positions as well. And we deploy in support of domestic emergencies. So I've deployed on 8 or 9 different missions to include setting up a temporary hospital at the Javits Center in New York City during the pandemic. So my first position with the Public Health Service was with the Indian Health Service. I was a diabetes program manager for a tribal health clinic in Alaska. And this entailed a combination of community prevention and program management with a little bit of clinical work sprinkled in as well. I then had the opportunity to transfer to the Food and Drug Administration in Vermont. And that's where I've been for approximately 14 years. I became an FDA investigator there, essentially inspecting food manufacturing facilities, ensuring that they're in compliance with federal standards and federal regulations. We conduct international inspections too of food manufacturers who export product back to the US. So I've had the opportunity to inspect in 9 different countries, covering Europe, Asia, Central America, and South America. And more recently, I accepted a position with the FDA as a compliance officer. And this position ties me back to the desk, and I handle administrative procedures related to the enforcement of sort of the newly minted produce safety rule. So essentially, I'm looking at how we ensure that farmers are producing safe produce for consumers. And that's it for me. Thank you.
Thank you. Major Julianna, do you want to go next?
Sure. Well, thanks for the opportunity to be here and talk to you all about what a career in the Army for a dietitian or a public health professional looks like. So I got my undergrad in nutrition, graduating in 2006, and then went on to do the Army's internship. So it's neat to see a fellow Army internship graduate on the panel. And then I went on to, so that incorporates also a master's in nutrition from Baylor University now. And so I did that program because I really felt like having that combined experience of the master's and the internship would be very helpful, since that's kind of the way that our profession is moving to. And so after graduating from the Army's program, I went on to do several different positions in clinical, food service management, and outpatient nutrition. And really, it was in my time during outpatient nutrition, I was doing a lot of overweight and diabetes education, and really felt like public health, there was an opportunity to impact policy to where we could make a change for our service members in our environment that would perhaps prevent some of the sorts of nutrition issues we were seeing. I also kind of recognized that clinical really wasn't for me. And so the Army has a program for a scholarship to go to a university of choice to pursue your doctorate studies. And so I applied to that and then was accepted and got my public health, went to a public health school at the University of South Carolina and did my doctoral studies in health promotion, education, and behavior. So that's a similar program to what Emily Sanchez is going through. So she's a fellow Army dietitian as well. So you may know her from your program. So after pursuing my PhD, that's a very condensed program. We get 3 years to do that for the Army. They say, we're going to do this scholarship for you, but you have to complete your total dissertation, everything in 3 years. So I did that and then went on to my position now at the U.S. Army Research Institute of Environmental Medicine. And so for those of you who maybe aren't aware, the Army has several research sites that really focus on human performance or issues that are around people. So not the sort of material research, but really research around immunology, around burn and critical care, and around, for us at USAREUM, around human performance and performance optimization. And so at USAREUM, we have 3 different divisions, and I'm assigned to the military nutrition division. So as a dietitian, as well as having sort of a public health hat, my work really focuses on looking at the environment and the culture and how that impacts our warfighter nutrition, their eating behaviors. What are the factors that are associated with military service that might impact the sort of food choice behaviors that they make? And then in turn, how does that affect the nutrition-related health outcomes that might be a factor in our soldiers not being ready to do their job? And so really my work is focused on a little bit of intervention work, but a lot of epidemiology. I have a variety of different projects going on where we're looking at evaluating Army health promotion programs, as well as really looking at new types of food ration products and how that might impact performance among our soldiers. I think that pretty much covers my talk, and I need to also say I'm a mom of 5 and it's a Saturday morning, so if there's a little background noise, I apologize, but please, I'm open to any questions about sort of my career path, as well as, how do you balance being a parent and being a mom and having a career? Thanks.
Thank you. Yeah, that will be very helpful to know. Yeah, thank you. And Ayten, do you want to go next?
Sure. Hi, everybody. It's awesome to be here this morning, and thank you so much for having me on. My name is Ayten Salahi. I am a GI specialized registered dietitian, but I didn't start off thinking that I would land here at all. I actually started off as a neuroscience and psychology researcher, specifically in a neuropharmacology lab at the Duke University Medical Center. It was at that time I started learning about the cellular pathways that connect the brain and the enteric nervous system, and the way that those systems are modified under major depressive disorder, generalized anxiety disorder, alcohol consumption, and the way that certain types of food might have an impact on those cell pathways. So this was a decade ago. So we were really just kind of starting to understand that stuff a little bit better. So I also realized at that time that I did not want to be in a cell bio lab. It was a really interesting material, but I thought, I want to learn a little bit more and have more of like that one-to-one, maybe patient interface. So I went on to do clinical research for diabetes management. I worked in a global research study portfolio looking at the usefulness and utility of an artificial pancreas system for the management of type 1 and type 2 diabetes. So at that time, I was based in Los Angeles, and LA is known for many things. One of them is the great food scene, but another one of them is this kind of degree of health, wealth, and food disparity that is just impossible to ignore. So at the same time that I was learning more about research and the role that medical nutrition can play in the management of non-communicable diseases like type 1 and type 2 diabetes, I was also getting really curious about why is it that there are certain neighborhoods in Los Angeles that don't have access to the same resources? Then you could be in the ritziest part of LA and drive 10 minutes down the street and be in a completely different environment that doesn't have, the fancy grocery stores or really much of anything. So I started getting curious about health disparity and food access, food apartheid at that time. And I started getting involved with the Los Angeles Food Policy Council, learning about urban agriculture, getting involved in like food gleaning efforts locally to try to divert some foods that would otherwise be wasted, fresh fruits and things like that, into food banks. And it was during that time that I realized that I just wanted to pivot entirely into food and study it from every angle, from the public health angle to the direct one-to-one patient care angle. So I uprooted from Los Angeles, moved across the country after 5 years in clinical research to Tufts Friedman, where I did my master's degree. I actually did the food policy and applied nutrition degree. I don't know how many times they've changed the name since then, but I know they've changed it a couple times. So I did study that, and I did my DPD at Simmons University, and I completed my dietetic internship at Mass General Hospital in Boston. And kind of throughout that whole time as well, I was identifying that there were a lot of food and nutrition professionals, particularly in the dietetic space, who were really interested in both clinical aspects of care, but also in the sustainability piece and learning about how we can take a more active role in driving a more sustainable and equitable food system. So during the time that I was in my master's, I actually founded a grassroots organization called the Planetary Health Collective. And we are a movement of food and nutrition professionals who are passionate about leveraging our unique skills, passions, platforms to further climate action within our field and in various dimensions of the food system. So that has grown quite significantly. We host free educational online events. We host career panels very much like this one to provide other food and nutrition professionals with ideas of ways that they can get involved in sustainability or integrate sustainability into their work efforts. And that's the Planetary Health Collective. I was also recently elected as a chair-elect of the Hunger and Environmental Nutrition Dietetic Practice Group in the Academy of Nutrition and Dietetics. So I'll be stepping into that role this summer. And I also run a virtual private practice that bridges plant-based nutrition, medical nutrition for GI conditions, and also some components of eco lifestyle and sustainability. So if anybody has questions about, the uncharted path, I'm here to answer those kinds of things.
Fantastic. Yep, thank you. Next, Agnes.
Hi, everybody. So yeah, again, echoing everyone, thank you so much to all the organizers, and thank you everyone that's here on a Saturday morning. So I started my nutrition journey in undergrad at Cornell. Cornell has a really big nutrition department, so it was really fortunate that I was able to learn early on about like pre-dietetics and what does it mean to be a dietitian? What's the path? And so like through their guidance, I applied to internships. And at the time I was like, okay, I think I really like the clinical aspect of things. I was really big on the science and just like the little details and things like that. So that led me to the Tufts combined Master of Science and Dietetic internship. So that was a 2-year program that I completed, and Tufts is also known, Tufts internship is known for pretty clinical focus. It does give a really, really good like well-rounded program, but the clinical part is one of the strengths there. So yeah, I just learned a lot about the foundation of medical nutrition therapy through really, really broad patient populations. Like we got a pediatric rotation, we had adults, we had like all levels of acute care. So that was really helpful in setting a good foundation. So then afterwards I was like, okay, I have all this clinical knowledge, like I feel really comfortable in the inpatient setting. So like most, maybe, I don't know how many nowadays, but I went with that clinical path. I started working as an inpatient dietitian for adults at University of Illinois in Chicago Hospital. But my passion just ever since I was like little, always, I loved kids. Like that's just kind of my core being, I just love working with kids. Like I was a Sunday school teacher. I like volunteering with kids. I babysat so much of my life. So I knew pediatrics was something that I was interested in, like from the start. I just was also trying to give everything a chance. But one of my favorite rotations at Tufts was also the, there's a local elementary school, what's it called? Josiah Quincy, I think, right across the street from the medical center. And we did, a few class educations on sugar sweetened beverages and things like that. So in order to figure out how to get more into the pediatric space, because it is so specialized, so different from adults, I took a jump from clinical and started working at WIC, which is Women, Infants, and Children in Chicago. And even though it wasn't very clinical, that talking and communicating with families was such an important skill that I had to develop, because it's not just the kids, right? It's the whole family. And so talking with parents and seeing like what else is going on in their household and in their life to optimize the nutrition of the whole family was, just a really great experience. And fortunately through WIC, I was also able to get my lactation specialist certification and training. So I do also lactation counseling as well. And so through all those experiences, I wanted to get back into kind of more clinical. And so where I am today is the outpatient dietitian, pediatric dietitian physician at Harlem Hospital in New York City. And it's a referral kind of based clinic. So, there's a clinic of primary care providers that see all their kids, right? And then if any of those doctors feel like, oh, they could benefit from talking to a dietitian, they refer me, and then they'll see me for, truly a wide variety. Every, I think, institution slightly different, but at Harlem, it's newborn to 21 years old is pediatrics. I actually have a 22-year-old because he just turned 22. So really, really wide variety. I guess the most common things are, as you'd expect, obesity, prediabetes becoming more common, hyperlipidemia, but also a lot of like autism, picky eating, developmental delays, and the struggles with feeding that come with that. Failure when it comes to babies, a lot of failure to thrive, just like weight issues, formula, figuring out the right formula. And of course, if moms are breastfeeding, kind of helping them feel confident and know how to breastfeed, how to optimize their baby's health with breastfeeding. Now and then a tube feeding, kind of more rare like GI disorders, things like that I see as well. So it's been really, a great learning experience so far. And learning how to talk to such a wide variety of families and parents and patients. The Harlem kind of community is a lot of like West African immigrants, bit of a lower socioeconomic status, but I was comfortable with that also because of WIC. So kind of, I feel like every step of my journey so far in my short career so far has really helped me, come to this moment. And I feel like it's, things are constantly changing and you're learning so much. And, a lot of the pandemic happened, right? A lot of my patients now are like, oh, well, during the pandemic, this and this happened. And so now we're trying to get back to healthier habits. So working with that has been, really rewarding. And so, and pediatrics is again, like kind of a more specialized field of dietetics. And at first I was really intimidated about how to get into that space, but I had a help of a lot of mentors and I reached out to the pediatric practice group that the Academy has. And so all things that, we could talk about more in detail if you have questions, but if you have a passion, follow it, you can do it.
Thank you, this is great. And also welcome back to Tufts. So I really love that each of you had coming from such a different background, even we are working in the same field. So I'm curious, based on your experience, what kind of skills or experience have you found to be the most helpful or impactful in terms of helping you to advance your career so far? Are there any classes or experience that you had at your school or other places outside the school that have prepared you best for the current job? Maybe we can go with Agnes first, and then we kind of do a reverse order here. Yep.
Yeah, so I think for pediatrics specifically, again, was really fortunate. Tufts internship did have a pediatric rotation, both in the NICU, outpatient peds, and inpatient peds. I think that is more than I maybe most internships may have, correct me if I'm wrong, but so that obviously helped with exposure. But on top of that, I still used my extra, your optional rotations and things like that to shadow more pediatric dietitians. I feel like any dietetic internship, because you're constantly doing different rotations and you're constantly adapting, that adaptation skill I feel like is actually also really helpful in really any work setting. Working with, I'd say, different multidisciplinary team members, that's something I really learned in my rotations in my internship, is how do you communicate with not just other dietitians, but doctors, nurses, social work, all those different fields, and getting more exposure to that, I think has made me more comfortable now, approaching different providers in my current role. Yeah.
Yep. Thank you. Ayten, do you want to go next? Yep.
Yeah. Sure. So I think I'll speak specifically to the GI, the gastroenterology concentration piece, because I know that there are a lot of aspiring dietitians and dietitians out there that want to get more involved in that particular area, but don't necessarily know how. And it's completely understandable to not know how. There's not a specific specialization track to become a gastroenterology focused registered dietitian in the US. So that is a specific title in other countries like Australia. So I would say that one thing that was really beneficial for me to gain that specialized knowledge was attending a dietetic internship that allowed for a 6-week concentration in the dietetic internship itself. So I designed just a gastroenterology focus, and that involved both inpatient and outpatient GI. every day. It was a lot of coordinating, but it was extraordinarily valuable because I got to spend a lot of time in GI surgery on the inpatient side, ostomy management, short bowel syndrome, IBD patients. And then on the outpatient side, I saw a lot more of the functional GI issues and kind of lifestyle management and the day-to-day ongoing management of those GI issues. And during that time, I also found it extremely valuable to complete the Monash University training for application of the low FODMAP diet for patients with IBS. The Monash University is the origin of the FODMAP diet, low FODMAP diet for patients with IBS. And they are the ones who conduct the ongoing research on like FODMAP quantities in food, which is, I won't get into the details of it, but it's something you need to know if you do care about working with patients with not only IBS, but other functional gastrointestinal disorders. So that was a fabulous training. So if anybody is interested in that space, I would recommend seeking out a dietetic internship that has a concentration time, and also completing the Monash training.
Great, thank you. Major Julianna, Jen, yeah.
So I would speak to the more of having a total research focused role as a dietitian. Was that I think that when I started my PhD program, or actually even before that, I knew that statistics was very intimidating to me. And so it is something that I think is intimidating to a lot of people when they go into doing research, is that they can understand the results and they can understand the reason for doing it, but the how you get there is pretty tough. And so when I went into my PhD program, I really focused on research methods as being everything that I had, like in terms of cognates, or in terms of like what you would call like our electives, what we have in a dissertation program. Really, I focused on research methods. And so I think the way that you get around being intimidated by something is you just immerse yourself in it and you just absolutely try to understand, as best as you possibly can. And so all of my cognates were focused on research methods. It was really important to me, knowing the way that the Army works and knowing the assignment that I was going to have a really good foundation and being able to be my own, really run my own statistics and really be sort of a well-rounded researcher. And so I would say that for those of you who really want to do research as like your career path, you think that you want to end up doing some sort of research role, that, you really just don't let those things that you maybe are worried about not being as good at intimidate you. You immerse yourself, you find really good mentors and committee members and advisors who, have the expertise that you're looking for. And you just, do your very best to do everything you can to learn it the way that you want to learn it. And I think that it can be, again, a hard thing to do, but also really helpful for you. And it is, when you're going through it, it can be a little bit painful, but coming out the other side, I found it to be something that I've used a lot in my role. And then also something that's just been very beneficial for helping other junior researchers. And then I also have a participation in the master's program as an adjunct faculty member. So being able to advise students, it's been extremely helpful.
Thank you. Actually, I have a follow-up question. So in terms of, you mentioned sometimes this job requires like more solid information or knowledge about the research method. Do you think if a student who wants to pursue such a position, do they need to have PhD training, or do you think the master level training is enough? Because currently I know for dietitians, it is required us to at least to have a master's degree. I didn't remember which year it is, but yeah, if the job is research focused, do you think this PhD degree is required or not? Yeah.
Yeah, so and I'll just use the organization that I work for. We have a variety of research dietitians who work side by side with the principal investigators who have a master's in nutrition and function very well in the research lane. But I would say that if you're conceptualizing research and you're planning research and then you're doing the actual conduction of the final analyses, then you probably do need some additional training in specific research methods to answer your research questions. I don't pretend to be I'm not a statistician. I would never claim to be, but I have gotten proficient in the sorts of statistics that are required to answer the research questions for my research. And that's an ongoing thing. Like I've learned new methods and I've learned different types of analyses since I've been in this role to answer the research questions that I have. But I think that dietitians can function very well in that capacity as a master's degree, with a master's degree. But if you want to take it to sort of that next step where you are really like fully responsible for the planning, you're the principal investigator and all of those different aspects, then you probably would benefit from that advanced degree. But to be in a research role, it's not required. We have lots of different staff members that participate with a variety of different educational backgrounds.
Great, thank you so much. Yeah, next we'll invite Commander Joseph Frost to share your thoughts on this question. Yep.
Thank you. Yeah, sure. I'll try to come at the question from the perspective of kind of moving into more of a food safety and even regulatory enforcement perspective. And I guess what I would say is that I'm continually amazed at how versatile my background really is. And I say my background, but really, a background in dietetics. And so what I've learned throughout the years is that not only can we do the clinical roles as we think of with dietitians, but our background actually positions us well for a variety of other positions, as I'm sure you're very well aware of. But what that's meant for me is, the food science piece or the food safety piece of our background has translated for me to be on par with other professions who maybe had even a greater emphasis on those types of food science and food safety perspectives. And that background allowed me to start with the FDA. I'll say that it's been important for me to have FDA training throughout my career. So I've learned that the process, the educational process is continuing, and even as I've accepted a new position in the FDA, it feels like I'm back to square one in many ways. But on the other hand, it's really just been a continuum of building from that initial degree in dietetics. Last month, I found myself giving a presentation to other FDA colleagues on cyclosporic contamination, cyclosporic Ayatenensis contamination in produce and FDA regulatory actions. And a couple of years ago, I had no idea what cyclosporic Ayatenensis was. So it's just that continuum of learning and as others have said, immerging yourself into the field that you're currently in. And it's really just been a fun process, but I can trace all of it right back to that degree in dietetics and becoming a dietitian.
Thank you for sharing. So I would imagine there are some of people listening today who would like to have a job like similar to the one you are in right now. So it will be very helpful if you could speak to us some of the opportunities you have seen, as well as some challenges you have already faced in your role or in your industry or institution. So can you also give us some examples of projects you have done or you're working on? This time, let's go with Commander Frost. Yeah.
Sure. So projects that I'm working on now to start with, or for those who might be interested?
Yeah, I think maybe you can. I think this question is more about like what kind of opportunities you have already seen in your job, or any challenges you have already faced. But while you are speaking, you can relate to some examples of your projects, something like that. Yeah.
Okay.
Mm-hmm.
Yeah, I mean, the challenges, certainly the challenges are many. They always are. But as I look back at my career, I would say that the theme of those challenges has always been the challenge of having others focus on the value of health, of putting value on health. And if I look at that from my initial military days, certainly the military is focused on military readiness, and health is important to that, especially as so much as it facilitates military readiness. And so there's aspects of health that I think I would have preferred to see a greater emphasis on, right, outside of maybe that military readiness. And then as I transitioned to the Indian Health Service, I would say that I started that position thinking that nutritional health was going to be the one emphasis that I would bring to this position, and that it would turn everything around in this community. And what I learned is that in a lot of times, nutrition sort of had to take a back seat to all the other issues in that community. So, as I looked at the socioeconomic issues, as I looked at substance dependency, severe poverty, it wasn't always appropriate to focus on nutritional health. And that was the first time I learned that. And so again, another challenge of making that value, convincing others of that value of health. And then the FDA, I would say it's transitioned to changing the mindset of food manufacturers to who are generally focused on profit, right? But to ensure a safe product, and looking at and getting them to look at the public health significance of their actions. So again, prioritizing health, not always their health, but health in general, I would say is definitely one of the main themes. I do want to touch on, you mentioned if others are interested in learning more kind of about what we're doing, what opportunities are out there. And I do want to mention that I would encourage everyone to check out usphs.gov. And so that's our website. We do have opportunities for students. We have a student internship program. It's called Junior and Senior Co-Step. It's basically a paid internship with housing, healthcare, travel costs included. It's for undergrads, master's students, doctoral students. There's two main pathways, one of which is for students who are in their school break, and they can work alongside active duty officers during their breaks without a commitment to joining the service or anything like that. So there's more information on that at usphs.gov.
Thank you so much for sharing this information. And
Sure.
Next, let's go with Major Julianna, Jayne.
So I think that, I think the question is about opportunities for, how to sort of break into this kind of a career field. And I would say that, the education is huge. Obviously, that's your credential for doing this type of work that I do in research. But if you have an interest in research and you just don't know if you want to commit to like an advanced degree, I would highlight the Oak Ridge Associated Universities program, their Oak Ridge Institute for Science and Education program. We abbreviate that ORISE. And that is a program that actually sort of bolsters the scientific, workforce with essentially fellowships that are matched with a variety of different organizations. And so that's one of the ways that we at USARIUM bring in a lot of people who are interested in research, but aren't really sure how to get in, or this is their first time doing a research role. And so the way that works is that we have projects that are funded, and we will have project managers or research dietitians that we'll bring in to help with those specific projects. And we do a lot of that through the ORISE program. And so, yes, thank you, Emily, for posting that link. And so this is a great way to have a research fellowship. It's an educational opportunity. So it's not really like, it's not really the same as having like a job where you come in with a position description. You get to actually decide, these are the sorts of things that I would like to learn while I'm in this fellowship. And then And then we'll do that through project coordination or through your involvement in a specific project. And so we link the project that we have to the person's research interests and their background. And so the project manager that I have for one of my studies has a more laboratory background, but before that I had someone who was really an exercise science background, and then he's gone on to do his dissertation work. And so it's a really good stepping stone for deciding whether or not you think that research is the sort of environment that you want to be in before you invest in, an advanced degree. So I would highlight that opportunity, and there's lots of different organizations that have research fellowships through ORISE, including CDC and other sorts of government organizations.
Thank you. Yeah. Yeah, Ayten, please.
Sure. Yeah, so I think one of the main reasons that I decided to go into the field of food, nutrition, dietetics, and something that's a theme that I've carried with me throughout the whole process of doing the DPD, doing my master's, doing my internship, and then entering into the workforce again, is this idea that the nutrition field is so interdisciplinary and so intersectional, and that in my opinion, my perspective, the way forward in our field is to really embrace that intersectionality and to learn how to connect the dots between these different parts of our field that may feel like different topics altogether, but learning how to actually treat them as one issue. And so the way that I have done that is by staying really committed to helping others kind of learn how to connect the dots between sustainability, food, climate, and human health, right? Or the three kind of categories that it comes down to for me. And so we do some mentorship and training on those topics through the Planetary Health Collective. One way that we do that, of course, as I mentioned, is with those sustainability career panels, which are really great networking opportunities for people who are interested in the food, climate, and health continuum. And then another, of course, is that we do take on volunteers. And so we have some people who join us as staff writers. And what that means is people who are with any experience level, we will take you on if you're interested in learning how to connect these dots and writing with more nuance and more like accuracy on somewhat complex topics that might be new to you. So our whole ethos is that everybody is welcome in this work, everybody is needed in this work, and it's really, really important that we all learn how to talk about these issues as one rather than as separate things, because we know now that food, climate, and human health are so intertwined with each other. So as we take on new writers, people who are like more green in the field, we also provide that mentorship with them. So we pair them with writers who have a lot more experience, many of them who've actually come out of the Tufts Friedman Agriculture, Food, and Environment program, to provide feedback on their work and to say, hey, you might want to consider looking at this article or looking at this resource and integrating it in. So it's a very hands-on way to learn more detail and nuance in these somewhat complicated topics. So that's one project that we're working on. And then another one that we have coming down the pipe is going to be a project called Cooking for the Climate. And so that is going to be another topic. It's basically going to be like a virtual cooking class where I'm going to have on a co-host, and we're going to spotlight an ingredient, and we're going to talk about everything about like related to that ingredient, from the sustainability to like the cultural significance to any, like historical significance or anthropological traditional uses of that food or that ingredient, while we, the hosts, and people who attend the class are preparing a meal together. So that's another example of how we're going to be like tying in all of these different elements of food and kind of using food and nutrition as a way to as a unifier, and as to highlight the power of food as a tool for change making as well. So I would say that a challenge that comes up in all of this is that I don't think it necessarily comes naturally yet to many of us to think about issues in food, climate, and health as one thing. But that if you are really passionate about intersectionality and bridging these different dimensions into one career focus, that there is absolutely a way to do it. Don't let anybody tell you that it's not possible. And if you don't see a space where you can do that work, connect with me and or create your own space. There's no reason why you cannot create more intersectional spaces in food and climate and health. So
great point. Yep, thank you. Yeah, Agnes, please.
So, sorry, I just want to echo what Ayten said. Like, definitely, it's intersectional. Like nutrition. If you're in the nutrition space, like, there's just no way you can avoid it. Because I think me 4 years ago was like, even going to the food policy classes, because like we had to take all the different classes. I was like, oh, I can't do that. Like, I'm clinical. Like, I can do like the vitamin deficiencies and like medical nutrition therapy, right? But it's just WIC was such a great experience for me to realize, like, no, it is public health. Like, sure, you have to know the clinical things, but how do you get the families to then like bridge them together, right? Like, that's public health. And especially like, I could go on and on about WIC and about how just wonderful I think of a program it is, and how much it really helps you see, what it's like, talking to families that have young children, because WIC is, newborn to 5 years old. And again, I'm not a mom, but maybe Julianna, you can speak, like, that's a hard time. Like, moms don't know how to feed their kids if no one tells them, like, especially if it's their first or something like that. So being the nutritionist at WIC to help those moms, her parents, like, guide them through that is like a skill that, you realize, like, oh, this is like public health work. And in that you're still learning, a lot of different clinical things, but like, it all really just bridges together. And so another good thing about WIC, if you do want to go into pediatrics, is that depending on the location, like, you don't always have to be a dietitian to work at WIC. You can be a nutritionist often, like, without being a dietitian. So when I'm thinking about my coworkers, there were a lot of nutritionists that then went on to do their dietetics, like, DPD and internship. So it's a really good pathway if you want to stay in that kind of like families, women's health, pediatrics, nutrition. So I think that, like, you don't have to box yourself into like clinical. If you see the population you want to work with working in a different industry, like, you could try that, and then you can come back to clinical like I did. So like places like WIC, Head Start, like those programs, I think are really, really helpful if you want to get involved with kids and families. That being said, I do have friends that are pediatric dietitians that did a different way, right? So they did inpatient, they stayed in clinical, stayed with adult, just because that's usually the entry-level job is like adult. But then, while they were there, sought opportunities to cover the peds floor a little bit, or like, cover the NICU a little bit. And then through that, got more exposure and was able to then, switch into like a specialty. So my hospital that I worked at didn't have a big pediatrics floor, so that didn't like seem like an option for me. But depending on, the hospital you're in, that can be a way too. So like lots of different ways, but I personally really loved that the public health kind of track that I took, because it really opens your eyes to, like food access, food security, all of that with the population you work with. So, and then challenges, I mean, I think, like echoing what everyone said, I think that depending on the providers you're working with or the patients you're working with, like, they all come with such a different level of nutrition education and exposure. So, sometimes it's really easy to just talk about something they're like really engaged, right? Whether it's a parent or it's a provider, right? They're like, oh, okay, like, tell me more about this. Like, what do you think is good? And then there's others that would, often have to prioritize other things, right? And so trying to, have those conversations with like why nutrition is important, and, or they know it's important, but like how you can advocate for your field, and like why this would really, really benefit the patient or their family. So, and also I think when if you're working with a lot of doctors, nurses, like, again, their training in nutrition is very variable. Some get like none, or like one class in medical school. So often it's like educating and talking, like that interdisciplinary work, which I enjoy. Like, I enjoy, talking to residents and like teaching them about nutrition and stuff. But like the backgrounds are so different. So being the nutrition expert, you have like a responsibility to share that.
Thank you. Yeah, this is excellent. So yeah, I think it's time to open the discussion to the audience now. And I think for those who put your question in the chat, I will read the questions for you. But if you didn't have a chance to do so, please feel free to raise your hand, and then we will help to unmute you, and then you can just ask your question directly. Let's see. So I think in the chat, okay, someone asked, can you post how to join the collective SM sources? I think Ayten has already put the information there. And then Emily helped to share the link mentioned by Commander Frost and Major Jayne. Okay, so any questions from the audience? So okay, if no, I have another question for the speakers. So I think as the students, they are thinking about planning the career path and trying to think about what is the future of the field is. Some example on top of my head are like food-based medicine or precision nutrition, etc. So I wonder what the future do you see in the job market, or what the trends do you see or developing over the next few years? Yeah, who wants to go first? Just feel free to jump in.
I can tap in because I kind of started talking about this, I think, a little bit, but to me, the future of nutrition is intersectional. I mean, we know already that it's interdisciplinary, but it's about also bridging that concept with the types of jobs that we have available to us, right? So right now, the career pathways in nutrition can feel sort of divergent, but I see those kind of pathways merging into each other a little bit more. So us as dietitians in the future may have to have an understanding of sustainability, right? As climate crisis becomes a bigger and bigger issue. And there's also, I think, a big emergence on plant-based diets in general. If you look in the market, or if anybody follows the Food Institute, for example, one of the biggest emerging areas now in the market is like plant-based meat alternatives, or like plant milks and things like that. So I think also we'll see that there's an emergence in a need for more specialized training around understanding plant-based diets and within the context of various conditions, medical nutrition therapies that we're offering to our patients. And also there is a bit of a diversity issue in our field, right? So if we look at the statistics from 2020, which I think was the last needs assessment survey done by the Academy of Nutrition and Dietetics, the field is 80% white. So I think we're also going to see an increase in the diversity of our field, and also, I hope, an increase in cultural competence at every level. I mean, we know that that is very important to the Academy. We know that that's very important to every dietitian that I know. I've never met one that doesn't care about those topics. But there is an issue of decontextualization of our training from cultures that we're working with in a clinical setting. So I do see that also being a big area of focus. So for me, it's kind of the sustainability piece, the cultural competency piece moving forward, and the plant-based piece.
Thank you. Yep.
I think if I could add on to something that is very pertinent to what our society has been through over the last 2 years, is that I think we can't really take into account yet the effects of COVID and the pandemic and what that's done to our entire population, and how that impacted nutrition, and how that impacted people's food choice behaviors, and really what's going to, inform the future and how we are doing nutrition. And so I think that there's a big challenge in how do we both sort of encompass what we've been through, as well as then learn from that, and you know, incorporate ways of this sort of experience that we've had as a society, which certainly it's not impacted all of us equally. And so how do we then figure out, you know, how can we put in public health programs that are more protective in the future against having something like this happen, and how it really did harm some of our most vulnerable populations, and that's included in the military. You know, we have a population of people who are dependent upon you know, the military for their food service and for their livelihoods and for their nutrition. And so I think that, you know, I recently had a friend of mine who brought in a mug and it said, "Make epidemiology boring again," because epidemiology became like a term that everybody knew. Like, you know, epidemiology like became like a regular buzzword on the, you know, news. And so I think we need to think about how to use public health to, you know, for policies and things that will buffer against some of these sorts of huge environmental or huge societal you know, issues that we have. And I think that that's still something we could learn a lot from, and just think about moving forward. And that's where public health is such a huge, you know, can have such a huge impact in our culture and in our society.
Thank you. I saw there are 2 questions in the chat. So one student had a quick question. What's the proportion of international students working in the nutrition field in military? It's a really fascinating topic, but I'm curious that whether it's difficult for international students to join.
So as far as to join the military, it is required for, you know, them to be U.S. citizens. So, and we have the same diversity issues that the other panelist was referring to. We are really working on diversity and inclusion with our master's program. That is an emphasis, particularly going forward. And that has become an emphasis for the academy as well. So I would say that there's limited international students working with us in the military because of that citizenship requirement.
Thank you. Yep. So another question is, I'm curious whether the panelists could enlighten us on pathway or what you know for students who are interested in transdisciplinary fields such as nutritional neuroscience. I think maybe this question is for Ayten.
Yeah, I'll jump in. I mean, immediately my thought is to try to find some professionals that are doing that work. So if you are specifically interested in nutritional neuroscience, go look into some resources where you first learned about that intersection or that concept. Or if you haven't researched yet to see if that's something that's being done, take a look out to see who's out there, get to know the players in the field. And a lot of the time, people who are kind of at the forefront of bridging those topics are really open to talking to other people who are interested in coming into that work. So I would say find those people and connect with them as soon as possible, reach out to them, and I'm sure you'll make some really beneficial connections. That'd be a good place to start.
Okay, thank you all so much for sharing. So I just for the sake of time, I want to stop here, and I wonder if the panelists, you are fine with, like, if students have additional questions, they can reach out to you by email or LinkedIn. Okay.
Yeah, of course.
Thank you.
Sure.
And yep. So I just want to thank our panelists so much for participating in today's discussion and share your experience. Thank you so much for such a fruitful and insightful discussion. I'm really grateful for your support in making this student-oriented initiative a success. And yeah, thank you so much again, and everyone have a great weekend.